Thank you, Nicoletta. And I know that it's very late. I know that all of us, we are very tired because it's the last time for a long day. But this is very nice to introduce and to present the result of a specific cytoplasm extract of pollen in relation with a randomized, double-blind, placebo-controlled trials. These are my disclosures, and this is going to be the agenda. I'm going to present very quickly a review about the women urinary incontinence, and then I will speak about herbal remedies and the most important one, that is Femaxeen, and what are our results, and finally, what the potential mode of action. That this is very exciting, and we are working very hard in this. As you know, there are three types of urinary incontinence: the urgent urinary incontinence in relation with overactive bladder, and second, the straight urinary incontinence, that there are two different mechanisms of action: the urethral hypermobility and the intrinsic sphincter deficiency. And of course, you can have the mixed urinary incontinence. The distribution of different types of incontinence is very important to understand that there are more straight urinary incontinence and mixed, and the pure urgent urinary incontinence, the percentage is low. But in relation with the different age, you can see that in younger ladies, it's very frequent to have straight urinary incontinence, and in very old ladies, they have more mixed and urgent urinary incontinence. Well, this is exactly the figure that we have in our mind about the percentage of the different urinary incontinence. There are more stress than mixed, and finally, pure urinary incontinence. As you know, there are several treatments of urinary incontinence, depending on the type of urinary incontinence, but we need new therapeutic options. Why? Because when we speak about urgent urinary incontinence, we have drugs, but the majority of them, they have severe and important adverse events, and this is produced pure compliance. On the other hand, in the straight urinary incontinence, we have different kind of surgical treatments, but you need to take into account that the number of women that they are with anticoagulation drugs is important, and these are important group of risk. Then there are women that they have cardiovascular diseases and some other diseases. That means that to have a surgery is a risk, an important risk too. There are women that they like to have pregnancy, that they like to be pregnant in the next years. All of this group, they are a very important group that they don't like to have a surgery if they can avoid it. In other words, we need new treatments. And the question is, we have herbal remedies for this disorder? Well, the first thing that we need to speak is what is exactly the pollen composition of our drug and what exactly what we are speaking about. First, as you know, in general, pollen is the most important product of the hip. There are, as you know, 20 to 30 kilograms they produce of pollen per year and per hip. And the pollen, they have a lot of different components, as you can see here in the end. But the most important is the technique that the Sorellis company has. As you know, the technique is we can avoid the cell, that as you know, the cell is the allergenic carrier of the pollen, and to have only the nucleus with all the active ingredients and with no allergic components. And this means that we have all of the good components with any of the cell allergic problems. And if you compare, for example, the bee pollen versus the purified specific cytoplasm extract of pollen, you can see the huge differences between this group. The viability is nothing to be, only in bee pollen you can absorb 3% and you can absorb a lot, the majority of them, when we are speaking about our specific pollen. And then allergic, this is allergic. This is not because it's purified. And then unknown source, and here we know what we are doing and what is the production and selective production that we have. We need to analyze, and this is the reason why this drug works, not only for hot flashes, why we decided to introduce in this area, in the urinary incontinence area. There are different components, and there are some of them that are very, very important for us, as methyl serotonin and tryptophan is, but there are some other, as enzymes, cofactors, and some other vitamins and antioxidants that they are inside of the pollen. We have data before now in relation with pollen extract plus, in relation with the urinary incontinence, but in men. You can see here, for example, one paper that they say that they decrease the nocturia in an important percentage, the frequency, the residual urine, that this is important too, and we have another that decrease the nocturia too and the bladder empty. That means that pollen, only the pollen extract, they decrease the incontinence problems in men with hyperplasia of prostate. What we know too about the herbal remedies, we know the pumpkin. As you know, pumpkin, they have the curcubina pepo that works in urinary disorders. We have some papers to show clearly that this component, the curcubina pepo, they decrease absolutely the urinary stress incontinence that works too as natural product. And we have this other paper to say that it's effective too in overactive bladder. In other words, we can say that the curcubina works in stress and in overactive bladder. If you analyze this, this could be clever to do as Sorelis did, is to combine first the purified and specific cytoplasmic extract of pollen plus pumpkin seed extract in an important quantity and vitamin E. This is exactly the product that we are speaking about. That means that we combine these two natural herbal remedies and this specific cytoplasmic extract of pollen with the pumpkin extract to try to have better result in terms of urinary incontinence. And I am going now to present the result of our double-blind placebo-controlled trial in 76 women. And these women, they were divided in 4 groups, one with, mixed urinary incontinence and urgent, 26, another group with placebo, this was active group, and with our drug, with our product, natural product, sorry. And then this is a placebo group, but we try to know what's happened with the straight urinary incontinence too in our active group, number 12, patients, and with placebo too. That means that we have 4 different groups, 2 active and 2 placebo, depending on the type of urinary incontinence. This is exactly the flow chart that you can see here exactly the difference and the 2 major groups. One major group that is active and the second one placebo. With an important number of patients, 76 in this type of work. This is nice. What was exactly the assessment of the urinary incontinence? We decided to do 3 different questionnaires, the very well recognized International Consultation of Internal Urinary Incontinence Short Form, the famous ICIC, urinary incontinence short form, the measure of urinary handicap, the HU questionnaire, and finally the severity index with the Zambic incontinence index. This is exactly the demographic data that we have. The majority of women, they were around 60. This is the typical age where the women, they express that they have more urinary incontinence. And these are the results. This is the most important issue, the result of the study. In terms of severity, the Zambic incontinence severity index, you can see exactly what's happened after 60 days and after 90 days. No doubt that you have beautiful result and very significant in terms of the diminution, decrease the sum between incontinence urinary. And if you see here, the very severe, then moderate and weak, and if you see here the last column, you can see exactly the differences. When you analyze the evolution in the MHU score according to the treatment too, you can see exactly more or less the same. You decrease the urinary incontinence in general, all of the types of urinary incontinence in comparison with placebo. That means that the active group was okay and was working very nice. In terms of the ESIC, you can see exactly the same thing, the other questionnaire. Again, you have beautiful statistical differences after 60 days and after 90 days in comparison to the baseline. In other words, in these three questionnaires, we can confirm that the PSCEP, our specific product, is working in comparison to placebo. Other point was to analyze what's happening with the different type of urinary incontinence. And we decided to analyze what's happening with only straight urinary incontinence in blue, the urgency urinary incontinence, and the mixed urinary incontinence. In all of these type of urinary incontinence, you decrease and diminish the risk. Again, we can confirm the good results. And in the SIC questionnaire, probably the most important one and more recognized and very well known, we have exactly the same result. After 16 days, you can have a significant result in comparison in all of the three types of urinary incontinence. So it's okay for stress, urgency, and mixed urinary incontinence, our natural product. Of course, after this result, we decided to analyze in detail the mechanism of action. What are the reasons why this natural product works as well? We need to know in detail why it works and what is exactly the pathway for it. And well, we can present a beautiful and very elegant studies with our product that in relation with modulate the acetylacetate mRNA expression. The acetylcholinesterase, what this exactly means, that if we increase the expression, we are going to decrease we can decrease the acetylcholinesterase. If we do this, we can avoid exactly the muscle constriction. In other words, we increase the esterase and we decrease the cholinesterase. We was working too about something more, and this is a beautiful picture about what's happened with the famous M3 receptor. We need to know if our pollen extract, specific pollen extract, they can work in the M3 receptor. As you know, the normal product that we use are antimuscarinic. That means that if we present some result in this way, we can understand how works our natural product. And we can say that absolutely is an antagonist activity. It's a light antagonist activity, but they have an antagonist activity, no doubt in this way. And the most important one, no agonist activity. That means, again, this is a favorable point to say and to understand why this work in relation with the detrusor muscle. Other probably mechanisms of action are more in relation with other pathways in relation with the sphincter. For example, we know that our specific pollen extract, they inhibit the serotonin reuptake, and if they do this, this can relax. They can increase the sphincter. Other way is that, as you know, the pumpkin is very well known. The extract, they can work in the 5-alpha reductase. If they can work and you increase the testosterone, again, you are going to have a strong sphincter. In other words, you have here exactly what are the explanation for our product. First, we can work here to decrease the acetylcholinesterase, the acetylcholine. That means that if you decrease the acetylcholine, you are going to reduce the muscle constriction. The second one is that you inhibit the 5-alpha reductase, and two, you can work as selective serotonin reuptake inhibitors. All of these areas, they are in relation with the sphincter. These two things, they can explain why this product works, first, in straight urinary incontinence, and then, and this area is explained, the straight urinary incontinence, and this other area, they can explain why it works in the urgent urinary incontinence. That means that this we are very exciting. We continue working this area because they can, the people, they can understand why, how works our product. Finally, I'd like to say some conclusion about this exciting product. First, Femaxeen is the name of the natural product that contains purified specific cytoplasm extract of pollen. Is something different. We know that the technique is very special, and the panking, if we add panking, in this combination, they can reduce the urinary incontinence. We saw that Femaxeen is effective for control of urinary incontinence using the 3 validated questionnaire. That this is very solid, the paper, the double-blind placebo-controlled paper, and we can say that Femaxeen significantly improved the urinary incontinence severity from baseline at days 60 and 90 compared with placebo, no doubt, and the score, about the SIG score, is improving too after 60 and 90 days compared with placebo too. No, well, the results, they are there, and they are so nice. And Femaxeen has a safety profile, of course, any secondary effect. And finally, Femaxeen was effective across 3 types of urinary incontinence. That is something unique in my knowledge. In other words, we are until a natural and very nice new product for urinary incontinence in general. Thank you very much.